The young couple's short trip out to buy some milkshakes has ended in this.
Very early stages in relation to the investigation. Got our clinical investigation team here and they will piece together exactly what's happened.
Kirsty was riding pillion and thrown 20 metres down the road, landing on her back.
We're going to get you sorted in 2 tips. We need to just do a few little bits and bobs and get you on a special board, and then we'll get you down to hospital, alright? We'll only off a wee bit.
She hasn't moved since and has no feeling below her waist.
Because she's not able to complain of pain, then yeah.
Paramedic Sammy thinks she may have broken her pelvis. Pain Kirsty can't feel.
You're just going to pull tight across your hips, Kirsty. Alright.
They need to move Kirsty very carefully.
1, 2, 3, run.
And when they begin to move her, boyfriend Gordon reacts badly.
Alright, then, hi. Is that your leg? It's alright, it's because we're moving on to another board, you can
Just relax, they can use 2 tips. Start.
The crew would like to fly both patients, but Helimed 99 can only carry one. And Dr. James decides Kirsty's injuries are the more serious.
Yeah.
Gordon too has serious injuries, but he is refusing to take any pain relief.
Are you sure you still wouldn't like some gas and air? Yeah?
It seems whilst Kirsty is around, he wants to keep a clear head.
Well done. Have you ever been in a helicopter before, Kirsty? No.
Paramedic Sammy knows her patient could have spinal shock, bruising to the spinal cord from which she may recover.
They'll be sat right at the side of you, alright?
If not, she's probably permanently paralysed.
Brilliant.
Dr. James still has to deal with boyfriend Gordon. He's going to go by land ambulance.
Can I have a quick look at this arm? Just straighten this arm out for us.
Straighten it out for us.
Take your elbow.
Sammy has to answer an awkward question.
Why can't I feel from the... Well, you might have bumped your back, that's why it's hurting, and that's why we'll take you to the hospital and get you checked out, okay?
Just before they take off, another problem emerges.
How are we doing?
really hurt.
Your chest.
Feels like it's constantly
At the back or at the front?
all around.
All round.
Kirsty's blood pressure is dropping fast. It could be she's bleeding internally, and that could be fatal.
Big deep breath in for me. Out. You're getting lots of air into those lungs of yours, alright? I know it feels a bit funny, but it's just because you've strapped you down nice and tight onto this board, alright? And you're still good for the left there.
Both young patients leave the crash site at the same time. Gordon by land ambulance and Kirsty in Helimed 99.
So far what we've tried to do is stabilise the back as best we can. We've given us some good strong painkiller and we're getting into the Northern General in Sheffield where hopefully the spinal surgeons can take over from there. The helicopter's nice and smooth and it's going to limit any bumps and jolts that you may get on the road. Then we'll also get her into A&E at the Northern General as quickly as possible.